there's senior care housing, there's schools, and there's cooks that prepare foods for hundreds of people. And to manage that more in a professional version rather than a consumer app is something that we're going to take to market.
Another large market is the home healthcare provider.
Yeah.
Those home healthcare providers, can be given a device. This works on iTouch as well. So, a profile can be saved on an iTouch with photos. These are the products, the sizes, and the UPCs. Please go to the store and buy these, which in today's world, there are a lot of home care providers, especially for the baby boomer generation, who needs to care for their elderly parents.
Yep.
They're taking on a lot. It's all new, and these are all new conditions. So, to help them or, anyone else that has, a home care assistant, nanny, etc., it's the list in the palm of their hand.
So how do you guys do this, right? So it's a small team, right? I mean,
Very.
You alluded to 1,000 different hats, multiple hats that you're wearing. But, I've seen a lot of companies that have good ideas, maybe not great ideas like I think nutrisleuth is, but how do you manage this? So you've got to be able to, first of all, contain yourself enough to be able to get a product out on the iPhone, right? You got to start there. But then, I mean, what are you guys doing to be able to build the next generation that, the enterprise or the professional version of this? You go out and find some funding. Are you guys getting funding? How are you going to manage this as it explodes in the next couple of weeks when this product goes out?
So we are angel funded right now.
Okay.
We are in the midst of the launch, so we're going to put our heads down, focus on that, generate as much popularity and downloads as we can through the app, and then I think we kind of look at the market and we see where we want to go. I think whether we bring on somebody specialized for a different market or a different tool, we make that decision as it comes.
We're all about partnerships.
It would seem that. It seems like it's very, I wrote it down, it seems like it's very important for you guys to, and I think that's a great lesson, is to partner effectively.
Exactly.
It's been a huge lesson for me in business. So many people at the beginning, first, I'm sure that they said to Valerie, this is your idea, just keep it for yourself, just go pay someone to make it. Or I personally get approached all the time, I have a great idea, tell you what, I'll share it with you, then I'll give you 50%, you make it all.
Yeah.
We'll make millions. It doesn't work that way, and Valerie and I...
It doesn't? So there's a lesson for everybody who's watching right now. Yeah.
But Valerie and I also realized, having 100% of something for yourselves is great, but having 50% of something that's worth 5 times what you originally had, that's even better. The mission behind this business is first and foremost to make life easier for mom, to make life easier for anybody that has a special dietary need, and then to spread the word. There is a solution out there. So we're not going to be able to spread that word if we're trying to keep it all to ourselves.
Yeah.
There's plenty of room within the market for everyone to participate, and everybody will bring something to the table. And it's all about finding a strategic partnership and something that benefits the company. It's not about somebody coming along and going, listen, we'll give you $1 million just to get it off the market because we don't want our competitors to have it.
Yeah.
Or, here's some VC, just take this, but this is the direction we're going to go with it. Mm-hmm. It's about staying true to Valerie's original vision and keeping the integrity of the medical piece intact.
Yes.
And then going from there. And everything right now is just happening organically. We rely on Jeff to now guide the market as far as he understands what we wish for.
Yeah.
Our wish list of things. I just want to expand the product from a technology standpoint.
Mm-hmm.
Android, other platforms, integrating it into restaurants, into the Safety Dine program. That's all I want. Valerie just wants to reach her patients in general. All of her potential patients, all of her virtual patients. She wants to reach the consumer that she can help. Jeff,
I just want to make this company a success.
That's it.
That pretty much does everything
The
else.
grounded.
To the market, like I said, and see where our next product should be. They know best, and we'll take it where the consumer is.
It's interesting because it sounds like. Not only could you do this for the restaurants in a simple format, but you could also then take this core engine and license it to other shopping apps or other shopping websites. Or you said point of sale even, but really this is one of those add-ons that a lot of these guys, even the fitness applications, could be leveraging very clearly as basically a plug-in to their technology. Open architecture like that?
Give us a jingle. Because that's exactly what we're looking to do. This is not something, again, that we're trying to keep to ourselves. Jeff has been in talks with, again, another reason for us to slightly delay our launch to the consumer, simply because we want to be in the best position possible in the market when we actually put the app out there. He's been in talks with grocery retailers, with
CPG brands, clinical trial organizations. There's a lot of use.
Like the White House.
So
no, really, the White House.
The White House is basically running an initiative to open up data to developers, let these developers build applications on this data and improve consumer health.
Yeah.
And it's called Health 2.0. It's the government initiative. And they're actually featuring our application in their inspiration gallery on something you could do with data to make consumer lives safer, better, healthier, etc.
So this was great because Valerie and I are plugging away. We're out there, we're looking for someone to help us, and everybody has a connection, right? Oh, what I can do for you.
Of course.
Okay, but are you going to do the work? Because
Yeah.
we need someone to help us. So Jeff comes in, and maybe 3 weeks into working together, he says, "Okay, well, I set up this call, and it's with the White House." And we're like, "White House." Okay. So a phone conference is set up, and we get on the line, and there is basically one of the people from the Executive Office of Science and Technology and Health and Human Services, and some of the most noted people in healthcare and healthcare policy, and the Health 2.0 conference that they're doing in San Francisco in October, and they watch our demo video. And they say, "Okay, well, we'd like to feature you as the app that other developers that are in this initiative should aspire to." We're like, "This is great."
There's a halo over Jeff right now, and I'm excited to see him. It's good.
But really, there's so many people that speak about, well, let's do this, let's do this.
Yep.
It's different when you're really in the development of it. You need a team that takes action.
Yeah.
That's what this whole movement has been about. And so the partnerships that we're looking to form, they're not partnerships for money per se. They're not partnerships for prestige. They're partnerships that will move our own initiative, our own mission forward. Then they're smart partnerships. And that's what we're looking for. And, we will entertain any ideas that come in.
It's interesting you use that word mission, because often ideas are a facade, right? Somebody exploits an opportunity in the marketplace where it's underserved, but I don't have a passion. It doesn't have an impact on me personally, but I know that I can fill that hole, and I'll do a half-hearted attempt, and we'll get something going. We'll go, but it always comes from the wrong reason. But it seems to me like nutrisleuth comes from the right reason, where you can speak passionately about what you're doing, and you believe in the outcome of this, that it's beyond just a simple application, simple product. And is that, you've all been involved with multiple companies before, is that what you do you see that as a common thread for success and failure in something like this? Like, you have to believe in what you're doing?
I think you have to believe in what you're doing, and I think you have to solve a problem. I think public health is definitely a problem right now. I think food is probably driving 90% of that, and I think enabling people to be informed at the point of decision goes a long way to solving that. And I think you need somebody to develop that understands that problem, and Paul is the perfect person for that.
It's very cool.
And I'm the end user.
Yeah, but that, like, if it's a product that you'll use, right? I think that's the difference between, something like a game or something like a to-do application, or something light, we'll call it. So you said that now before we were talking, before we started recording this, you talked about the impact that you've had already, the number of people that are coming at you, the requests that you're getting.
The contact form on the website.
Yeah, I mean, you're saying like, an incredible number of people that are reaching out to you, and you've already had, people requesting an Android version. You haven't even launched your iPhone version yet. And
requests for different versions and different platforms. We've had requests from manufacturers who contacted us and have asked to be included in our database because they have a specialized product line that they would like to reach the consumer. We have people that have suggested features, that have asked for just different things. That the most important thing is that they're communicating their needs.
Yeah.
And anytime you put a product out there, if you, as advice to somebody that is creating a product and trying to put it onto the market, you may think that you have the best product.
Everybody
you put
does.
everything you have into it. You think you've planned for everything. Innovation is quantified in the marketplace.
Yep.
Pure and simple.
Yep.
So listen to your consumer, because if your consumer is not giving you the positive feedback that you're looking for, something is wrong with your product.
It's a very important lesson. It's a very important lesson.
And so this feedback that we're getting, we feel that feedback is giving us the justification that we need to spend 20-hour days going forward to make this thing happen.
So how are you creating awareness inadvertently? And then, I mean, what is your plan to kind of amplify that? You said at the beginning, before we went live, that you've been doing this on a shoestring, and even with angel investing, a round of angel, you still want to do it on a shoestring. It doesn't give you, the clout to advertise in national television stations and newspapers. So, how have you done it? How do you plan on pushing this out even further?
To this point, we haven't officially launched. So we've been going through friends and family and personal PR connections, and doing the usual startup thing where you just call all your friends and you get on different websites and different blogs and different media centers. And beyond that, we do plan on doing a pretty professional PR launch, marketing the app as best we can. And it's really going to be success is going to be driven by how many consumers we can connect to.
Yeah.
I think there's two things here. One is good ideas find their way. If you have a good idea, the word of mouth is going to catch on. We've already been on the news.
Yeah.
We found ourselves online.
Yep.
And there's a syndicated news story that has been, making its rounds on various news channels as their, healthcare interest story. That's great. That is putting a voice out there. It's hard to say that because we're not in the market, so that's not translating to dollars for us.
Yeah.
But again, our mission is to get the word of mouth going. So that is fabulous. The second thing is we're in New York City.
Yeah.
So, the buzz here definitely has that trickle-out effect. I've lived internationally.